lifestyles are the key factor in the development of some of the most common illnesses like heart disease, cancer, diabetes, stroke, emphysema, or what we call COPD, and the list goes on and on. Are you a smoker? How much alcohol do you consume? Do you have a consistent exercise program? How good is your diet? Are you overweight? How much stress is there in your life? How you answer these questions gives physicians and other healthcare providers the answer they need to determine your health risk and what diseases you may possibly develop. In other words, the way you choose to lead your life will go a long way in determining the kind and type of disease your personal physician will be treating someday during your lifetime. Clinical research has shown us that 70 to 80% of heart disease could and should be avoided if individuals would simply decide to follow healthier lifestyles. One of my professors in medical school shared that when he was attending Johns Hopkins University, he learned that in 1920, the rate of heart disease in the U.S. was 1 heart attack per hospital per year. Look at how the statistics have changed in just a few short generations. So many of my patients now believe that because their father or grandfather died from a heart attack in their 40s or 50s, that they most likely were also going to die at a young age from a heart attack. However, when you begin to realize that heart disease was really not that prevalent until the past half-century, you begin to appreciate the fact that it is primarily the result of poor lifestyles and not because of our family history. Nearly 60% of all cancers are felt to be a direct result of our poor lifestyles or environmental exposures. Dr. Gladys Block looked at over 180 studies that followed large populations of people and looked at their antioxidant blood levels. Those who had the highest levels of antioxidants in their bloodstreams compared to those who had the lowest levels had 2 to 3-fold decrease in almost every cancer. Therefore, if you simply eat the recommended 6 to 10 servings of fruits and vegetables daily, where the highest concentrations of these antioxidants are found, along with taking high-quality, complete and balanced supplements, you can significantly decrease your risk of all cancers. Because of our poor diet and inactivity, it is estimated that 1/3 of this present generation is going to develop diabetes sometime during their lifetime. However, clinical research also shows us that 90% of the cases of diabetes can and should be avoided. Therefore, even if you have a strong family history of diabetes in your family, becoming diabetic is basically a choice. It depends primarily on the way you choose to live your life. Physicians need to be spending more time and effort with their patients, encouraging them to firmly establish healthier lifestyles instead of just waiting until they become ill and then prescribing medication. I have learned that eating a healthy diet that contains those good low glycemic carbohydrates, those good fats and good proteins, along with having a modest, consistent exercise program and taking high-quality nutritional supplements is key in giving you the best chance of avoiding the devastating consequences of heart disease, cancer, diabetes, and stroke. The choice is yours. I would encourage you to make the decision today to do what it takes to be more proactive in protecting your health.